Today, we are going to decode the subtle and sometimes, not so subtle signals our body sends when a really key hormone is out of balance. We are talking about low estrogen. So, have you ever had those days, maybe even weeks, where you just feel off? Like you're more irritable than usual, your brain feels a bit foggy, or you just don't feel like the person you know you are? Well, it turns out the answer might be hiding in your hormones. So today, we're going to play detective. We are going to investigate the clues your body might be giving you that point to low estrogen. The investigation starts now. Okay, so first things first, we need to understand our main suspect here. What exactly is estrogen, and why is it so important? Well, think of it as the conductor of your body's entire orchestra. Yes, it's a primary sex hormone, but its job goes so far beyond just reproduction. It is a master controller, sending out messages that affect countless systems all throughout your body. And I mean, its job is incredibly wide-ranging. Estrogen helps manage your body temperature, it influences mood boosters like serotonin, and of course, it runs your menstrual cycles. But it also plays this absolutely crucial role in keeping your bones strong, your skin elastic, and even helps with brain function. So you can see when the conductor is offbeat, the whole orchestra can kind of fall into disarray. All right, let's start with the most obvious clues, the physical symptoms. These are often the very first things people notice when their estrogen levels start to dip. So the first major clue is feeling like your internal thermostat has just gone completely haywire. One minute you're freezing, the next you're kicking off all the blankets. This is because estrogen is a key player in regulating your body's temperature. And what's really fascinating is how these things are all connected. See, low estrogen can trick your brain into thinking you're overheating. The body's response, a sudden hot flash. That can then lead to night sweats, which absolutely wreck your sleep. And sometimes you might even get heart palpitations, where it feels like your heart is racing. It's all part of your body's confused, over-the-top reaction. Now, beyond temperature, low estrogen can show up through some pretty distinct changes in your cycle and even the way your body is shaped. Changes to your period are often one of the earliest signs. They might get unpredictable, lighter, heavier, or sometimes just gone. You might also notice some weight gain, especially around your midsection, because estrogen helps tell your body where to store fat. It even affects your skin's collagen, which can lead to dryness, and it can cause other symptoms that really impact your quality of life, like a lower sex drive. But the clues aren't just physical. Honestly, the impact of low estrogen on your mind and your mood can be just as profound and sometimes even more disruptive. And if this is something you've been feeling, listen, you are so far from alone. In fact, up to 70%, that's 70, of people in perimenopause report going through significant mood changes. So what you're feeling is real, it's valid, and it is very, very common. When estrogen dips, it disrupts brain chemicals that regulate your mood. That can lead to everything from irritability and anxiety to that frustrating brain fog where just finding the right word feels impossible. You combine that with poor sleep, often thanks to those night sweats, and you can get stuck in this vicious cycle that just crushes your concentration and your confidence. And for some, it can even trigger hormonal migraines. Okay, so we've identified the clues. Now let's get into the why. What causes the body's estrogen conductor to step off the podium in the first place? Well, for many, it's a completely natural part of life. Estrogen levels drop way down after you have a baby. Then they start to fluctuate, sometimes wildly, during perimenopause. That's the transition leading up to menopause. And of course, menopause itself is the most common reason for a permanent state of low estrogen. But menopause isn't the whole story. There are other factors that can cause low estrogen too. Things like the surgical removal of ovaries, certain autoimmune conditions, cancer treatments, and even lifestyle factors like really high stress, over-exercising, or eating disorders can play a big role. And it's really important to know that while we think of estrogen as a female hormone, everybody has it. In people assigned male at birth, low estrogen can also cause symptoms. They just look a little different. Things like a lower sex drive, more belly fat, or other physical changes. Okay, we have investigated the symptoms, we've looked at the causes. Now for the most important part. What do you actually do with all this information? Let's talk about solving the case and figuring out your next steps. The very first thing to do is be your own best detective. Start tracking your symptoms. Ask yourself, how are they really affecting me day to day? If they are disrupting your life, it is time to talk to a healthcare provider. And this is really, really crucial. Some symptoms, like severe chest pain or a sudden severe headache, require immediate emergency care. Don't wait. When you do talk with a provider, there are a few different paths you might end up discussing. Hormone replacement therapy, or HRT, is a common and really effective option for a lot of people. For others, birth control pills can help regulate hormones before menopause. And you should never, ever underestimate the power of lifestyle changes. Things like diet, exercise, and stress management can make a huge difference. Ultimately, what this all really boils down to is this simple but powerful idea. Just by learning about this stuff, you have already taken the most important step. Understanding what your body is trying to tell you is the absolute key to finding answers and feeling like yourself again. So, I'll just leave you with this one question to think about. Your body is in a constant conversation with you. The real question is, are you listening? Thanks so much for digging into this with me today.